Today, I'll be explaining to you what is physiotherapy and who are physiotherapists. Hi, I'm Fred with Physio Explain, where we help you understand medical conditions and learn self-management strategies. If you're new to this channel, make sure to subscribe. Now, let's jump into it. Physiotherapists are university-trained healthcare professionals and movement specialists that help people restore movement, regain function, and improve quality of life. Physiotherapists commonly attend university for 4 to 7 years, and they graduate with either a bachelor, master, or professional doctorate degree. People commonly ask, what type of conditions can physiotherapists help? Physiotherapists are primary care practitioners, which means they're qualified in doing assessment, making diagnosis, and treating any condition that impairs people's movement and function. Some of the common conditions that physiotherapists treat include lower back pain, osteoarthritis, stroke, traumatic brain injury, and COPD. You may have noticed, physiotherapists can treat a variety of different conditions. Referring to the Canadian and Australian Physiotherapy Association, physiotherapists may specialize up to 20 different fields, and they include mental health, animals, emergency, and women's health. What makes physiotherapy distinct is physiotherapy is an alternative to medication and surgery. Physiotherapy focuses on evidence-based and patient-centered care. What this means is physiotherapist provides patients with the latest and best evidence in regards to management of their condition. Even more, physiotherapist works closely with the patient, and together they develop a treatment plan that is accepted by both parties. The question of the day is, have you ever seen a physiotherapist? And what condition was it for? Let me know in the comment section below. And finally, thank you for watching. I will see you next time.